One reason why I would argue that we do need a lot more time to look at this is that even in the speech 2 days ago, the president made 3 very important assertions about the final product that I think are highly questionable and need to be verified. There's a sort of a says who kind of factor to this. Who's going to verify that these assertions are actually taking place and the bill's being written? Some neutral party needs to say yes or no. And they're pretty important questions. He sort of said 3 things. He said, this will not increase the deficit now or in the future. By the way, it used to be this was going to solve the deficit problem in the long run, but we're set that aside for the moment. Now it's just, it won't increase the deficit now or in the future. There has not been anything presented by anyone that comes close to meeting that test. Not by a long shot. I mean, the basic structure of what's taken place in the House is to create a new healthcare entitlement to get people into the coverage. Very predictably, CBO and others, anybody else who's looking at this, is going to expect that that's going to grow at roughly the same rate as Medicare and Medicaid has grown for 40 years, 8% a year, more or less. And the offsets for it, you know, perhaps cover it for a 10-year period, but more or less they expect will grow at 5%. And so you have this, you don't have to be a financial genius to see that this is a problem, right? You got to disconnect, and it's going to make the problem much worse, not better. And not by a little bit, by like leaps and bounds. So you have this gigantic disconnect there. I think that's a huge issue that has to be resolved very clearly before they vote on anything by someone, not the president himself just making an assertion. Someone's got to take a look and say yes or no or probably not. When Dr. Reischauer was running CBO, he used probably a lot. You know, you don't need a definitive answer all the time, but you need good judgment of people looking at this saying probably yes or probably no. And, you know, when you look at these House bills in particular, let's talk about the Senator Baucus' proposal in a minute, but the House bills in particular, it's very clearly not. It doesn't come close.